Doctors at major hospitals here in Seoul are about to walk off the job to express their discontent over the government's decision to increase medical school admissions from next year. Prime Minister Han Duk-soo ordered hospitals to ban the mass leave. But at the same time, the PM and other officials are preparing measures such as expanding telemedicine services in case an exodus of doctors cripples hospital operations and patient care. Shin Se-byuck starts us off.
Tensions between doctors and the government are mounting as an expected massive doctor strike is only a day away. Last week, the Korean Intern Resident Association announced that all residents at 5 major hospitals in Seoul are scheduled to submit their resignations by the 19th and will cease working after 6 a.m. on the 20th. This move is in response to an announcement by the government earlier this month saying it would increase the overall medical student quota by 2,000 to more than 5,000 by 2025 to address the chronic shortage of doctors in rural areas and specific medical specialties. The number of trainee doctors at these 5 major hospitals is approximately 2,700, accounting for over 20% of the nation's total. Should they proceed with their collective departure, it will inevitably lead to a significant gap in patient care. In fact, as of last Friday, a total of 715 residents across 23 hospitals have submitted their resignations. None, however, have been officially accepted yet. The government has also issued return-to-work orders to 103 doctors who have declined to work, with 3 failing to comply. Medical students are also gearing up to join the protests, planning mass leaves of absence. Last week, representatives from 35 of the nation's 40 medical schools agreed to submit a group application for leave of absence on the 20th. According to the Education Ministry on Sunday, some 160 medical students from Wonkwang University filed for a collective leave of absence, though these requests have yet to be processed. Amid the backdrop of collective action by doctors and medical students, the Health Ministry on Sunday sent a stern warning to doctors if they do not comply with the government's directives.
We will address the collective actions of the residents by following the law.
Under local medical law, the government has the power to revoke the licenses of doctors if they are criminally punished for not complying with an order to return to work. Meanwhile, Prime Minister Han Duk-soo held a meeting with related ministries and announced a set of measures to address the medical community's collective actions on Monday, including expanding telemedicine services.
To ensure patients face no difficulties in accessing medical facilities, we will fully allow non-contact medical consultations in case doctors walk off their jobs.
Such services in South Korea have only been partially allowed since 2020 in the wake of the COVID-19 pandemic and have been expanded to patients in remote areas at night and during holiday periods only. Han also announced that the government plans to designate a total of 409 hospitals with emergency rooms to be on emergency alert mode to minimize any interruptions in care for patients with urgent needs. Shin Se-byuck, Arirang News.